Welcome back to Outcomes by Design, the podcast where we explore the evidence, innovations, and strategies shaping the future of healthcare outcomes. I'm your host, Dr. Kristin Baier, Chief Medical Officer at Onsera Health. Today, we're discussing a topic that's becoming increasingly important for employers, health plans, and benefit leaders. For years, the obesity conversation has centered on whether people could lose weight. Today, thanks to advances in obesity medicine, we're asking a different question, and that is what happens after the weight comes off? Recent clinical studies and a newly published meta-analysis in the BMJ have brought renewed attention to weight maintenance, long-term treatment strategies, and the reality that obesity is a chronic disease, not a short-term health condition. And to help us unpack what the latest evidence means for patients, clinicians, and employers, I'm delighted to welcome Dr. Melanie Jay. Dr. Jay, thank you for joining us. Can you give our audience a glimpse of your background as a double board certified internal medicine and obesity medicine physician?
Absolutely. So I started out in primary care, and I was very concerned about how obesity was affecting my patients and that we knew very little about how to adequately treat this. And this was over 20 years ago. And so I became more and more interested in treating obesity and doing research related to how do we better treat obesity, especially in primary care settings.
Thank you for that. Yeah, it feels like within the past 5 or 6 years, really when Ozempic came onto the market or semaglutide, that's when people started realizing that obesity is a medical specialty in itself. And it's so nice to see more attention being brought to this area of medicine. And before we dive into the studies themselves, let's start with the bigger picture. When many people think about obesity treatment, they think just about losing weight. But why is that an incomplete way of looking at obesity care?
Absolutely, because obesity care is so much more holistic than just weight loss. We know that obesity is a chronic and biologically driven disease, and it is a disease of excess adipose tissue or fat tissue. And this fat tissue causes inflammation, insulin resistance, and the added weight causes mechanical stress. And thus, people with obesity are increased risk of many other diseases, such as heart disease, diabetes, cancer, arthritis, and many other comorbidities. And it is also a chronic disease, which means it needs to be managed long term. And so even though we are getting these more potent treatments, we don't yet have a cure. And it means that by treating obesity, our goal is to prevent further disease and to enhance survival and quality of life. And weight loss itself isn't the main goal, but it is the reduction of these preventative diseases and conditions. And with weight loss, we do get reduction in harmful visceral adipose tissue around the organs, and this can improve health and survival.
Yeah, that's something we're very passionate about at Onsera and Population Health Partners. It's not just the reduction in morbidity and mortality, but really improving health span overall. And you just said so many important things. And I think one thing that isn't commonly known there is that adipose tissue or what we call, fat mass, it's an metabolically active tissue. It's not just idly sitting there storing excess calories. It is causing inflammation and a whole host of other downstream effects from that. So I think that was a really good call out, and that it is a chronic disease and there is no cure. And one of the things I often tell employers is that we wouldn't consider hypertension cured because someone's blood pressure improved for 6 months on a medication. And we wouldn't discontinue every intervention supporting diabetes management after someone, reaches a normal A1C level. Yet obesity is still often viewed differently. I still hear people saying, okay, you lost weight, now it's time to come off the medication. Why do you think that mindset persists?
Yeah, I have a lot of patients they say, I just want to take the medicine to help me, and then I'm going to continue the natural way. And people think the natural way is somehow better and has as a halo, and that you're a more moral person. And this is just part of a larger obesity stigma. And we know that obesity is highly stigmatized. And more than 60% of patients say that they have experienced discrimination and stigma, even in healthcare settings. And when you Google obesity, you see a lot of like pictures of headless people and bellies and butts. And we don't even realize that this is really dehumanizing. And we just take it still on when I watch TV and people talk about obesity, you still see like a headless person. And and so people think, and it's part of it is just this misconception that people think that obesity is caused by a lack of willpower or poor habits. And when reality is that obesity is largely genetic and it's as heritable as height. I'm very short and no one can tell me that this is my fault. It's like most diseases, it's caused by an interaction with our genes and our environment. And so that includes where we grow up, what food and physical activity we can choose from, what medications we get. A lot of the medications I give my patients can cause weight gain. And there's a whole host of other factors. And so what got us there is very hard to reverse because when we try to lose weight, our body tries to fight it and increases our hunger hormones, might decrease metabolism, what we call metabolic adaptation. So willpower alone, which can be very important when adapting any new behavior and treatment, including medications or not, is not enough. And obesity is not caused from lack of willpower. And there's no better way or more moral way of treating it.
Right. It is seen as a moral issue or a moral failure, and we're doing such a disservice to society in general, and of course to our patients who already feel shame, and it's tragic. I'm really hoping we can start moving the needle on changing that mindset. And an area I'm really interested in too, back to your point of it is largely genetically driven and influenced by our environment, is epigenetics and how our environment can turn on and turn off genes, which can actually have a generational impact, not just for yourself in the present, but for your children, for your grandchildren. It's really fascinating how much our environment influences our genetics. So, how should employers really think about obesity differently if they want sustainable health outcomes rather than just short-term results?
Yeah, I mean, kind of what we're saying is they should realize that obesity is a chronic disease and that we need to support our employees and our patients to stay on treatment. And also, they need to think about the cost of obesity in a different way because I do hear all the time, oh, it's too expensive. And I was recently on a panel at the American Diabetes Association with Tim Dahl, who did a lot of economic modeling and showed that there's huge potential cost savings in our country if we treat obesity. Over 10 years, like $1.8 trillion just in the medical costs. And that's not including reduced absenteeism and reduced disability payments, which both are in the hundreds of billions of dollars in savings. So there are huge costs to not treating obesity. And that's not even taking into consideration the millions and millions of lives that he projected saving by treating obesity.
Right. We like to tell employers you can't afford not to treat obesity. And with some counterfactual modeling, you can really see what happens to healthcare cost if you don't treat obesity. And it's really astounding. It's truly in employers' best interest to treat obesity, not just for the long-term savings, but also with like presenteeism and absenteeism and just more productivity while they're working. It really has short and long-term impact when you treat obesity. And
Absolutely.
like just kind of pivoting to some of the recent studies that have been getting attention. The BMJ published a systematic review and meta-analysis, and it generated considerable attention because it examined what happens after anti-obesity medications are discontinued, specifically GLPs. For listeners who may not have read the publication, can you summarize what those key findings were?
Sure. So meta-analysis is considered a lot of times the highest form of evidence, and they took 37 studies representing 63 treatment arms and about over 9,000 participants, and they examined weight change after discontinuation of weight management medications. It included a lot of the older therapies as well, and the mean treatment period was about 39 weeks, and follow-up was about 32 weeks. And after medication discontinuation, the average weight regain was approximately about zero point 0.4 kilograms per month, or about 4.8 kilograms in a year, or a little over 10 pounds if that rate continued. And the cardiometabolic markers kind of returned towards the baseline in about 1.5 years.
Yes. So what stood out to me was that weight regain appears to begin relatively quickly after treatment ends for some people. Of course, there are some people that successfully do keep their weight off, and it'd be great if we can figure out, what differentiates these people, if it is truly just lifestyle or something else going on. But what does that tell us about the underlying biology of obesity?
Yeah. Well, first of all, we definitely need more research in this area because maybe there are, and we'll get to it, but maybe there are a lot of other ways that to help keep weight loss, either with lifestyle or other medications. But what it tells us about the disease is that once someone develops obesity, there are changes that happen that don't just go away by starting a medication for a year. So it causes a disruption in the signals, obesity itself, that regulate our appetite and metabolism. We have signals between our brain and our gut. And when people lose weight from lifestyle alone, for instance, the body will respond and try to go back to their original weight or their set point. And it'll do this by increasing hunger hormones, decreasing fullness, and lowering metabolism, which again is metabolic adaptation. And so the medications act on these very pathways that are disrupted. And so when you take away the medication, those pathways still exist. And so the beneficial effects go away. And it's just like when you take away blood pressure medicines, we don't get surprised that the blood pressure goes back up.
Exactly. And I like that you mentioned the set point weight. I think there's a lot of patients who have gone up and down in their weight over the years, and they find it so frustrating that weight loss maintenance is often harder than losing weight in the first place because of these biologic adaptations. And it always seems to be they go back to where they started, maybe a little higher, maybe a little lower, but right around that set point weight. So
Agreed. I've had patients who've lost hundreds of pounds in their lifetime. They are not unmotivated people. They are super motivated. They've done this again and again and again, and they kept having the same result.
yes. And, some people hear this and they think, oh, the medications fail. They only work while you take them. But that's not really the conclusion they should draw, is it?
No, I mean, again, like we said earlier, we do not have a cure yet. So we can think about the medications putting obesity into remission. And they're treating a chronic disease. So we need to treat it chronically. And also, what happens is sometimes a medicine will work for a while, or bariatric surgery will work for a while, and then people will kind of start to creep up again. And that's because obesity can also be progressive. And so we need to add treatments over time, sometimes stronger treatments.
So I think you hit on an important point there too, which is, some people are on GLP medications, and when they get to their goal weight, they think they can reduce the dose or even space out the injection frequency. But what I have seen in practice is that yes, some people can reduce the dose, but some patients actually need a higher dose just to maintain their weight loss because of this progressive nature of a chronic disease. Um, but in many ways, like these findings reinforce that the medications are addressing a real biological process. And when the treatment stops, the disease process remains. Would you agree with that?
Absolutely. Yes.
And so this BMJ analysis isn't happening in isolation. We've also seen a growing body of evidence focused specifically on maintenance. It's like we know these medications work, people lose weight, now what? So let's start with Surmount 4. What was the study designed to answer?
So that study was designed to answer what happens after you lose weight on tirzepatide, what happens if you continue it or if you stop it. So everyone received tirzepatide and they initially lost about 21% of their body weight, which is a great response at 36 weeks. And then they were randomized to either continue the medication or get a placebo. So they did not know which arm they were in. And what they found is that the placebo arm regained 14% of their body weight at 88 weeks, while the tirzepatide arm continued to lose an additional 5.5% of their body weight. So people stayed on the medicine, they continued losing weight. People came off the medicine, they started to gain weight back.
Yeah, and that is pretty consistent with what we see in clinical practice. as well. And we're now seeing additional studies such as Surmount Maintain and Attain Maintain, just exploring maintenance strategies. But stepping back from like the individual trial details, what broader trends are you seeing across this body of research and in your own clinical practice?
I mean, I think that we really need to do more research to better understand how to maintain weight loss. At this point, the best strategy is to keep people on their current dose. The other trials that you talked about, the Attain Maintain, for instance, switched people onto an oral medication called orforglipron, and they were able to maintain a lot more weight than if you just put them on placebo, but still not as much weight potentially as if you kept them on it, and or going down to a lower dose in one of the other trials and of tirzepatide, and again, patients did better than placebo, but they still gained back a little bit more weight than if they had stayed on it. Maybe there are also other lifestyle strategies that could be helpful in helping patients maintain weight loss if they want to stop taking the medication. But at this point, with our best knowledge, is to stay on treatment. Now, the other thing, though, that's super important that I struggle with is that any treatment's hard over the long term to stay on. Adherence is a big issue. And so to me, strategies to improve adherence over time and to maintain people on those medicines is not a small challenge.
You're absolutely right. And, this is where I think at least at Onsera, where we're really focused and I think personalizing the treatment path for patients is so important. And we're just in a time now where you see a lot of companies popping up that really are just transactional medicine. Here's your prescription, no lifestyle counseling. They automatically titrate the dose every month, which can be too aggressive for a lot of patients. They feel miserable. They don't want to stay on the medication. And no one wins in that situation. The employer isn't seeing their return on investment. Weight is regained. The metabolic benefits disappear. So I think adherence is something really important we need to solve for. And I think we're making improvements there. But a few years ago, the conversation was really how can we help people lose weight? Like lifestyle's important, but often doesn't work for a lot of people long term. But now the conversation is really kind of shifting with GLP medications to how do we help people sustain their health improvements for years, which is largely driven by adherence. Would you agree that that's where the field is headed in terms of research and kind of natural progression? I'll say the natural progression of what we're seeing today.
I hope so. I mean, those are the questions that I'm most interested in is now that we have these great treatments, how do we best implement them? How do we best sustain and get the benefits? Because what happens in clinical trials can be very different than what happens in the real world. So I think these questions are super important.
Yes, yes, agreed. And, let's bring this back to employers because many of our listeners are CHROs and benefit leaders and just healthcare decision makers. So employers are often balancing two realities. And first, that's that obesity represents one of the largest drivers of long-term healthcare spending. And second, they want confidence that their investments are producing lasting outcomes. So, how should employers interpret these maintenance findings?
I mean, I think we need to interpret them to mean that for now, we need to have a good maintenance strategy. If you're going to cover the medications, you need to also think about maintenance. And we have so much more to learn about how to help patients maintain weight loss and health. But we also know that if we just take away the medications after they lose weight without a plan, it'll lead to a reversal of the benefits that you're trying to achieve.
Yes, and like my advice for employers and CHROs out there is be a little skeptical of companies that are saying we can help your employees lose weight for a year, then we're going to take them off the medication and they're going to maintain their results, either through like an unsustainable diet, like keto perhaps, or just that really aren't selling anything, for a long-term ROI. They're just focused on the short term. Get them on the medication, take them off, you'll get a return on your investment. And that's just not accurate in my experience and what we're seeing.
That would be a
So
big red flag. Absolutely. Yeah.
yes, yes, I'm glad we're aligned there. And one of the challenges we see is when obesity treatment is viewed solely as like a pharmacy strategy. The evidence increasingly suggests that outcomes are influenced by much more than medication alone. Can you talk about the role of nutrition, behavior change, having that clinical support, and just ongoing engagement?
Yeah, first I'll talk about nutrition and then I'll get to clinical support and ongoing engagement. So, I mean, nutrition, even if lifestyle alone isn't a great weight loss tool, it is one of the most important things for health. And so it's incredibly important, and not only for enhancing the effectiveness of the medications, but also for helping patients manage side effects. Like a lot of those GI side effects can be managed with nutrition, which will then keep the patients on the medications longer. We also need to prevent adverse outcomes. We need to prevent malnutrition, and we need to prevent too much muscle loss. And so while we're still learning the optimal level of support for nutrition, nutrition is highly important and will also help manage all the other conditions that a patient might have besides obesity. In terms of clinical support, patients often stop treatment because of these side effects. Again, we talked about internalized stigma, thinking they should lose weight the natural way, a lack of understanding about obesity as a chronic disease. So, clinical support involves a lot of patient education and counseling to support and promote adherence. And also, as I said before, patients have busy lives and stress, and it can be hard to sustain health behaviors. And so, having that support will help people to do that. And also, like we said before, that obesity is a chronic and progressive disease. So the medications might stop working. We might have to adjust their other medications. For instance, they might need less blood pressure medications. That might go down, or they might be able to come off of diabetes treatments. And so that kind of ongoing clinical care is important because as people have success on obesity treatments, it affects all the other aspects of their care.
Yes, I would say blood pressure more than any other medication. Maybe insulin, I say, is probably up there as well. But blood pressure medications usually need to be adjusted pretty fast in the weight loss journey for a lot of patients. And I've seen so many patients come to practice, and they're hypotensive and they're dizzy, orthostatic. Some have actually like passed out, while exercising and other things, which, that could be something else entirely. But a lot of times it's because they needed to have their blood pressure medication adjusted and no one was doing that for them. So like the wraparound ongoing clinical care is just really important. And I can't emphasize enough the importance of dietitians, that you alluded to with all the nutritional guidance that is just imperative, when someone is losing weight or just trying to improve their health in general. And that's something we think a lot about at Onsera. And the goal isn't simply just helping someone start a medication. It's really helping them navigate a long-term health journey with physicians, dietitians, coaches, medication management, and just personalized guidance. Because sustainable outcomes rarely come from just one intervention. Obesity is a chronic disease and it's multifactorial, and it's going to take, different components to really give the best outcomes. So they come from coordinated systems of care. And would you agree that that's where the field is moving as well? Not just here's your prescription, but we really need to think about the other aspects that are going to influence health with the medication.
Absolutely. And, unlike other chronic diseases, we have so much of a high percentage of our patients have this disease. And so you need to have innovative systems to even be able to address the enormity of the issue.
Yes, I completely agree. And I know we're getting close to time here, and I know you have a busy clinical schedule, so we want to get you back to your patients. But to wrap up, just a few quick rapid fire questions for you. The first one I think we pretty much covered, but I really want to highlight this again. Is obesity a chronic disease? True or false?
True. Learn anything from our talk.
If you're going to walk away with one message from our talk, it's that obesity is a chronic
Yes.
disease. And what is the most important misconception employers have about obesity treatment?
That they will somehow save a ton of money by not treating it. The costs will be seen in other ways with productivity, disability, the need for other medications.
Absolutely. And one thing every benefits leader should understand about the maintenance phase.
That it requires ongoing care and support from a multidisciplinary team.
And what excites you the most about the next 5 years of obesity care and I'll say research as well?
Yeah, absolutely. Well, it is a very exciting time, and there are so many medications coming and more options for patients. When I go to the meetings and the research meetings, we just hear about all these other treatments, and that means that the cost of the current medications will come down. But we do have to invest in ongoing care for patients and for research in terms of how to best support them in the long term. And if you listen to my TED talk, I also talk a lot about these issues and what I see is really important for the next phase of this obesity treatment journey.
Yes, and your TED Talk was excellent. For those of our listeners that have not heard Dr. Jay's TED Talk, you can find it on YouTube. It's definitely worth your time. And Dr. Jay, thank you so much for joining us today. I think the biggest takeaways from today's conversation is that weight loss is not the finish line. We have to be thinking about maintenance, that this is a chronic, complex disease influenced by environment and genetics. And the emerging evidence continues to reinforce that obesity is a chronic disease requiring a long-term strategy. So for employers, that means success isn't simply measured by access to treatment. It's measured by the ability to help people sustain healthier lives over time. And increasingly, that requires a comprehensive approach that combines a clinical care team, nutrition, coaching, medication management, and just this ongoing support. So thank you to everyone listening to Outcomes by Design. If you enjoyed today's episode, subscribe wherever you get your podcast and visit Onsera Health to learn more about how we're helping organizations improve outcomes through evidence-based obesity care. We'll see you next time.